Hello, everyone, and thank you for joining us today. This is Thrive Health's April 2022 Grand Round Speaker Series. Before we get started today, we're just going to open with a land acknowledgement. We are hosting this session for those of us on the West Coast from the unceded and ancestral territories of the Musqueam, the Squamish, and the Tsleil-Waututh Nations. We're also lucky to have both our team members and attendees and guests joining us from other territories across North America. So welcome in, welcome back if you've joined us previously for these sessions. My name is Marie and I manage marketing and communications here at Thrive. Today's discussion will be on how measuring and enhancing happiness can improve the delivery of healthcare. Just a few quick housekeeping notes. Please use the Q&A tab on Zoom to ask questions throughout the discussion. We will answer them as we go and endeavor to get to all that come in as always. We'll be moderating that tab just to make sure we don't miss any. We're also live streaming on LinkedIn today, and we'll also be recording the session as well. So I'm just going to introduce our speakers and then we'll get going and pass the mic. We're grateful to be joined today by Dr. Lara Aknin and Dr. John Helliwell, co-editors of the 2022 World Happiness Report. Dr. Aknin is a distinguished professor of psychology at Simon Fraser University, former fellow with the Canadian Institute for Advanced Research, chair of the Lancet's COVID-19 Mental Health Task Force, and co-editor, as mentioned, of the World Happiness Report. Dr. Aknin holds a PhD in social psychology from the University of British Columbia, and her research focuses on how the antecedents and consequences of happiness and pro-social behavior. Most of her work examines how generous behavior makes people feel. Her research has been published in various academic journals, including Science, Nature, Human Behavior, the Journal of Personality and Social Psychology, Social, Psychological, and Personality Science, and Perspectives on Psychological Science. And her research has also been covered in various media outlets such as CBC, CNN, Maclean's, Forbes, the New York Times, and the Wall Street Journal. Dr. Helliwell is Professor Emeritus in the Vancouver School of Economics at the University of British Columbia, and he is also a Distinguished Fellow of the Canadian Institute for Advanced Research. From 2006 to 2017, he directed CFAR's program on social interaction, identity, and well-being. His books include Globalization and Well-being, Well-being for Public Policy, International Differences in Well-being, all 10 editions of the World Happiness Report, and Happiness on a Healthier Planet, Planetary Health, Protecting Nature to Protect Ourselves. Recent papers include one with Dr. Aknin and others forthcoming in Lancet Public Health entitled Policy Stringency in Mental Health During the COVID-19 Pandemic, a longitudinal analysis of data from 15 countries. And in conversation with Dr. Aknin and Dr. Helliwell from Thrive today are Mark Nazemi and David Helliwell. Mark is Thrive Health's Product Manager in Clinical Solutions and Innovation, and David is Thrive Health's Co-founder and Executive Chair. And I will now stop talking and we will pass the mic to David to kick us off.
Great. Thank you so much, Marie, and to Neha for getting this all together, and to Lara and my father John for joining us on this conversation. Just to tee it off, and why Thrive Health is hosting this webinar is that we founded the company based on a lot of the principles of happiness and well-being, and recognized that it was not being properly acknowledged in the delivery of healthcare right now, both from ways of keeping people healthier and out of the healthcare system, but also treating them better when they're in the healthcare system. And there are really three different pathways that we think that happiness is important in the healthcare system. One of them is just recognizing that people's levels of well-being are going to influence how resilient they are through care journeys. So either staying out of the healthcare system or recovering faster after something happens. Another is, we think that there's a lot to learn about how people's levels of happiness and well-being can change through their healthcare journeys. And then, the golden ring in a lot of ways is, what are interventions that can happen to improve people's levels of happiness and well-being through healthcare journeys to keep them happier and healthier in their lives as a whole. One of the things I especially love about Lara's research that we'll definitely get into is the idea of benevolence and pro-social behavior, where there isn't just a caregiver who only gives things and a receiver who only gets things, but really each side of that equation is, is giving something and receiving something. So without further ado, I just wanted to jump in with a bit of a framing question to both Lara and John about, how is it that you actually measure happiness? Is it something, there's certainly people saying it's not an objective measure, so how can it be real? So overall, how do you measure happiness? And in particular, how is it done in the World Happiness Report? So over to you.
John, would you like to take that, or we can bounce back and forth if you like?
We can bounce. I'll start with the historical answer is that I think the reason the World Happiness Report is as widely read as it is because it sees all the countries of the world in a parallel way. We end up explaining what we think the differences are, but the world has treated our explanation as though it was the measure, which it isn't. So it's really important for everyone to understand that we collect from people around the world through the Gallup World Poll, the same kind of information that Thrive collects from its users. We essentially ask people to think of their lives as a whole, that the best possible life is a 10 and the worst is a 0, to rate their current life. And so that's our gold standard primary measure. We understand there are other ways of tackling into the issue of how well life is going for people, emotions and a variety of other things, but we find that the best umbrella is what we call a life evaluation. Over to you, Lara.
Yeah, I think so. I think you hit on all the major points there, which is that people self-report their own happiness with the same consistent question asked to respondents all around the world, which was what's so powerful and makes it appropriate for these kinds of comparisons. But David, you mentioned there's a hesitation, or sometimes a hesitation, because it's not an objective measure. So rather than triangulating and trying to figure out how happy people are by these external measures, I think the value and where the real kind of contribution of this work and the World Happiness Report and the work that surrounds it is that it's asking people to self-report on how they themselves are doing and putting their subjective experience kind of at the center of this and as the key outcome of interest. So it does, there's a bunch of research that kind of nicely supports it, showing the people who self-report themselves as happier are also the people that their friends and family see as happier. They're less likely to get sick. They're less likely to experience a whole host of negative outcomes. But what we're keenly after in the World Happiness Report and in a lot of my research elsewhere and that of others is really how people self-report their own experience.
Back to the health care, people who are skeptical of subjective well-being, you can say, well, now how skeptical are you of pain reports? Because pain is subjective. And so you have to take those reports seriously. Otherwise, you're missing the boat, and don't get drawn into treating some brain function as though it were the pain. That's not the pain, is what you. It's similarly with life evaluations. It's how you feel about your life, not how someone else feels about it, that's important.
Yeah, and it's not a coincidence that Mark has a portfolio that includes happiness and well-being as well as chronic pain, which is where you came from, Mark. So anything you want to jump in there for adding on that and more questions?
Yeah, there's definitely the connection to pain management when we're talking about people's well-being. A lot of times, even the definition of chronic pain, for example, includes emotional aspects of that. So even though you may have had a physical injury, but the pain persists because of the emotional fallout that people experience through their lifetime, whether that's because of trauma that's intergenerational, or incidents or stressors that they experience in their daily lives. For example, lower back pain, it's not necessarily a physical phenomenon, but it's actually an emotional pain that causes lower back pain. There's a huge body of research that explains that. So there is definitely a lot of interesting connection, and I 100% agree with what John mentioned in terms of, these are subjective perspectives, but they're important perspectives. This is how we capture, relevant information about a person's health and where they're at with their happiness or pain levels or whatever else that we're trying to measure.
Great. So, oh, good. I see one question just popped into the chat, and I was just about to encourage people to ask their questions. There is a Q&A button you can push, or you can put them in the chat if you'd like. So I'll quickly take a look at. Oh yes, talking about qualities and all that stuff. For how do you measure subjective? How it predicts other measures like qualities and others that he's listed, if you can see in the chat.
A lot of people treat subjective well-being seriously only to the extent it predicts something else they think of as of primary importance. And we often live off that the companies with happier workers produce more products. People who are happier are going to have more qualities, etc. And we keep drawing people back and say, oh, it's all very well, and it means that this is going to be an easy sell to your clients, your shareholders, or your users, that it does improve conventionally measured outcomes. But the whole point is we're looking at something that's an umbrella for all these other things. So it's worth doing on its own hook to improve the quality of life. That said, it's much more convincing if you can show something that you're doing is not only improving life, but some other thing that the person who's taking it on as a clinician or as an employer thinks is important. So that some of these experiments that have been done that about the way people got their training in the hospitality industry, they ended up with better lives. They were happier with what they were doing. They were more employable. But some of the evidence used was, do the people they have served come back and give a high rating to the hotel and come back and stay? The kind of things, the bottom line that matters to these people, and the answer is yes. So everywhere, when you apply something based on how you think it'll affect well-being, you also ought to monitor all the other things that are going on in these people's lives, because typically, because of this two-way causation, you'll find that the kinds of things that give you sustainable increases in the things you do want to measure also, in fact, give people better lives along the way. But measuring the better lives and understanding the processes that create them often opens your eyes to forms of treatment that you otherwise wouldn't have thought about. And in particular, this question of peer relations is a really important one, that when you're connecting with people to help manage their own health, one of the things you'll be thinking about is, what are the things that are not in the conventional rule book? And some of them are simply opening doors to these people to connect with other people whom they can help. To the benevolence question that you raised at the beginning and is worth more discussion.
It looked like you were going to jump in.
I was, excuse me, I was just going to say, I don't know. I think all the points John just made are really important. John, I was going to ask if this chapter may have predated my involvement in the World Happiness Report, but I think Richard has written a chapter a little bit about subjective well-being and quality of life years in recent years, or am I misremembering that? I feel like.
Well, the quality of life years were now his version of it, which of course is called well-being, which is well-being adjusted life years. So the question is, how happy are people, and then how long are they going to live? So it's a way of taking life evaluations that we concentrate on. You then link it up to the number of years they will live. Our measure includes how healthy you are. So we're sort of getting rid of the qualities by making them more based on people's own evaluations of their lives. So the quality was sort of expert driven for the weights. We're actually the weights that matter to how your health condition is are the weights that make you feel better or worse. So the relevant value for your physical, different physical abilities and disabilities is the one that people come up with themselves. So we use those weights to construct well-being adjusted life years. So that well-being alternative differs from the quality by being based on subjective well-being. It differs from our average measures we use around the world by multiplying it by life expectancy.
Right. Thank you.
We have a chat. We have a question from the group as well. They are asking, how do you account for language and cultural differences in respondents?
We have a chapter in this year's report, very interesting, because it was proposed by a Japanese foundation that thought that psychology was all Western oriented. So the questions and the answers were those that were specific to Western. So they had an extra sector in the Gallup World Poll in 2020 asking about balance in your life. Do you feel at peace with life as a whole? Do you focus on others versus yourself? And these were regarded as the kinds of things that Eastern philosophies would put at a higher level than the thought to be individualistic Western ones. The interesting thing was when the data came back, they showed that the countries that are at the top of the world happiness ranking, and especially the Nordic countries, were also happier. We're also the top of the world on questions of peace and harmony and focus on others rather than yourself, which is just one more example, and we've had many over the years, that in the astonishing universality of the things that lead people to value their life more highly. They're delivered in different ways in different areas of the world. You find in Latin America, they take the family more seriously and it matters more for them. There are other ways in which people organize that give you different answers. Gallup's been very careful about languages that are used to make sure they're using the right words in each language. And most of the differences we find now that are culturally based turn out to be second order relative to these universal primaries that we find astonishingly robust across societies.
Thank you. We have a couple more questions. How do you see climate change affecting world happiness in the future?
I don't want to talk all the time. You start with that, Lara, and I'll
Sure.
annotate.
I think the threat of the climate crisis is a looming threat for for everyone. And I think the shortest, most direct answer is that it's a very reasonable and important source of stress. We haven't been focusing that, at least on, not so much in recent issues of the World Happiness Report, but John can certainly speak more historically on that. But I know that there is quite a bit of research in psychology and other disciplines showing that people's stress about the climate crisis is negatively associated with their mental health and well-being. My hope is that the story doesn't end there. Hopefully, there are many there are theories in psychology and elsewhere that kind of argue emotions are designed to do many things, and some is to prompt action. And so I'm hoping that these negative emotional consequences or negative emotions that are associated with thoughts about the climate crisis might spur action, and that might also kind of be a tip to our future conversation, I think, about benevolence and whatnot. But also, I think another realistic extension of this is that it is one of few threats that I think we all face in kind of similar fashion, like COVID has been a recent one for us. And so hopefully this can prompt not just fear, but collective action and some kind of larger benevolence and interest to work together to solve the problem. So I think the most immediate answer is that I think the climate crisis is associated with negative mental health, but that it may prompt some action that could both alleviate the problem and maybe offset some of the mental health costs.
My supplement to that nicely phrased description from Lara would be that once you get deep into the determinants of subjective well-being, you realize that a lot of the methods people are using to either mitigate or reverse climate crisis are not the right methods. They're not the ones that reflect the science of well-being. So we know that people are much more likely to do something, not if they're pushed, but if they choose to do it. And that social norms are much more important than regulations. You give someone a regulation they don't believe in or a tax they don't like, they'll try and evade it. But if their objective is to improve the world and you can provide them ways to do it, ideally doing it with others, then you find that's where change is really going to happen. So my guess is that the really big changes in behavior that we're seeing now in some groups are much more important, how they're driven by what people want to see as a result, rather than what they're either ordered to do or asked to do. So it's back to this question of benevolence and common purpose. The most complicated thing about it is it's easier to get this sense of common purpose and I want to look after you. When it's close in, family, friends, colleagues, and so on, it gets tougher when you're trying to make what we call a social identity, the people you care about, the people you'll work for, that's broader in time or in space. So obviously, to deal with global warming, you have to have people's interest group, the people they care about, include people all over the world and in the future generations. And that, in evolutionary time, that takes a long time. But in intellectual space, that can be done much better. So it's this recrafting of social identities and who we want to look after that's critically important in this case. It's also the way to end wars, but that's another topic. I think we need to explore and make explicit what subjective well-being science can tell us about the right ways to approach the climate crisis. And frequently, it'll be common action to improve. And of course, it can start in very local environments, or fixing up your local watershed, or getting rid of the garbage on the streets, that then connect people better and convince each other that their neighbors are their friends and helpers and not the enemy. And the same has to do with different sectors of society, different industries, and so on.
Right. And we have a few similar questions. So maybe I'll just ask one that I think covers all three. Were there any special considerations taken into account in light of the pandemic for the report during the last 2 years? And what were they, and what was the most surprising outcome?
The biggest surprise in last year's report, which was carried forward in the new data, so as it were, we've had a fresh look at 2021 data to actually be quite consistent with the 2020 data, the astonishing extent to which life evaluations were resilient to COVID. And so that is telling us that the downsides, you destroy people's conventional social networks, you upend them, you lock them up in their houses. The straightforward well-being analysis says that is bad news. That's going to destroy everybody's life. But it turns out that for a combination of reasons, people were able to pivot their methods, and that although there were lots of costs, in fact, there were lots of offsetting benefits, so that you would find people actually discovering their neighbors, just as they were no longer spending so much time on their commutes. And we found that was true both in 2020 and 2021. 2020, there was a lot more negative emotions coming up, which by 2021, perhaps because of the vaccines and perhaps because of learning to live with the devil, those negative emotions came back closer to baseline. On the positive side, what we noticed in 2021 was quite astonishing, and we weren't expecting this at all. We were expecting some maintenance of social connections, But all three of the Gallup World Polls measures of pro-social behavior, donations, volunteering, and especially the helping of strangers, in every region of the world, those are significantly higher in 2021 than they were pre-pandemic. And that's obviously not a Me Too kind of thing happening. This isn't somebody else seeing something going on and deciding they're going to do it, because there was no planning, there was no advance information. Indeed, most of what you read about what was going on were suggesting people were withdrawing from one another and they couldn't do all these things. But in fact, it does give you a look at that. And of course, we know independently that these good acts are very strong supports for well-being. That's why, of course, in the healthcare, you want to give people a chance to help others with the same problem and so on, because you know it will not only help the other person, but in the long run will be good for their well-being too. So that seems to have been an important part of 2021. Lara comes at this from a parallel as well as connected point of view. She'll have something to add.
Yeah, well, John, by far the most surprising and uplifting finding for the 2022 report, I think, is this. I think I can't remember if it was we or some press coverage called this pandemic of benevolence or the surge of benevolence, which is, I think, a really lovely description. I think there are many reasons for why it occurred, or possible reasons for why it occurred, but that was certainly, I think, the largest surprise. I think there was another part of the question, which was, were there any adjustments made to study during the last year or two? And I think that there were some practicalities that perhaps aren't that exciting, but I think Gallup in the first year had to make some accommodations just for their data collection procedures. Normally they do, mixed methodologies, including some face-to-face visits in places that are hard to reach by phone and internet, and had to pivot, and those are the data that John is evaluating in chapter 2, and so obviously that had to change. It was back to more normal in 2021 for this year's report. But yeah, I think that, the report itself also had a clear focus on COVID, because this has been kind of in the limelight and front and center in everybody's mind over the past 2 years. But as John nicely pointed out, I think in some ways the findings were not that surprising, in that there was an initial upsurge in negative emotions, but also some surprising resilience in life evaluations. And part of that might be offset by this benevolence seen, especially last year.
Thanks. So, and on that, just digging into, the causes, I was going to ask about pretty much what you just said, so that's great around the benevolence, but how would you characterize the change in the global media response to the World Happiness Report? It's been 10 years. At first it all seemed to be about just the rankings. Now it feels like they're diving in and really getting it a bit more. How would you, Lara, first, how would you characterize this year's reaction? You mentioned a little bit about some comments on the benevolence in particular, but dive a little deeper there.
Sure. Well, in terms of the historical comparison in the 10 years, I think John is better poised to answer that, because he's been around for the full 10 years. I have not. But yeah, I think response to this year's report, I don't know if it was to what extent it was intentional on our end, but this upsurge of benevolence did receive a lot of attention. I think in part of the world backdrop of what is going on right now. Not only are we, approaching our 3rd year of a global pandemic, but also a war. I think people are struggling with the news that surrounds them. And I think this news of this uplifting message of benevolence with these really striking data, it's not just one little corner of the world. It's not just one measure. It's a pretty impressive, pretty consistent finding is striking and a really positive piece of news. But also because I think John foreshadowed this point, I don't think it's what we hear. I think the typical stories which aligns with public perception and previous data is that, we live amongst a pretty negative group of people. I think people have a pretty bad reputation, broadly speaking, and we don't have to look far sometimes for evidence of that. But I think what is often missed is the prosociality and the kindness that just, it surrounds us, and sometimes we don't recognize. And I think these striking data really brought that message to the forefront and was quite welcome news. And so I think that may have contributed to its coverage this year.
And over the longer term, the whole point of the World Happiness Report was to give some trustworthy measures that were not the kind of conventional GDP measures that people and commentators and governments were used to using as targets. It's the old, you treasure what you measure. To have these data out there was going to, in fact, change the conversation about how life was going and who to look to for good examples. The striking consequence of the World Happiness Report, in my view, the most striking, is it sort of shifted the world from focusing on economic development and its leaders as being what countries should focus on, to shifting to the Nordic countries, because they're the top. The 5 Nordic countries have always been in the top 10. People are now then writing books about this. They're studying what they're going on in their institutions. They're saying, what's special about life there? And of course, what's heartwarming about it is, once they start looking at it, then they find out that everything that's going, you don't have to move to Helsinki to have the happiness of a Finn. All the things doing is Finland has only created this happy society in the last 3/4 of a century. They were pretty unhappy and downtrodden and poverty stricken. That time they in fact have developed a set of institutions best characterized behaviors as caring for each other. A lot of these social norms are in common among the Nordic countries, and people who've written the books about it and then can come back and say, well, you don't have to move there. We can do here everything they do. Well, that's quite a dramatic reframing of the list of what makes a good life and how can you get there.
David, do you want to jump in for that?
No, I think you hit the nail on the head for the Scandinavian questions. We did have a follow-up question about what the Scandinavian countries are doing right. I don't know if there's anything you want to add to that, because part of your message was, they trust one another and they help one another, and other countries can do that too. Is there anything to add about what makes the Scandinavian countries special?
Well, that's the deepest fundamental. Some people then say it's all about big government, and then thank goodness Switzerland is in the top 10 all the time too. They don't have big government, they have small government, but the point is they have a setup that in their institutions, their public institutions, are well trusted and they care for everybody, and their private behaviors are mutually regarding. And that turns out to be very important. We often then say, well, people sometimes say they're homogeneous societies in the sense that they're all Scandinavian for generations and they know each other. But it turns out, in fact, that we then spent in one report, we looked at immigrants from all over the world to all countries and how happy are they, and it turns out the Nordic countries all have high immigrant shares in their capital cities, way higher than the global average, and that the happiness of migrants ends up all over the world, moving quite quickly to the happiness of the local residents. And so it's quite apparent that it's what's going on around people that's important. And of course, it can be changed because that's shown from what's happened to the migrants. And so migrants to Finland are the happiest migrants in the world. And then we, of course, immediately have to say, doesn't mean you all want to go to Helsinki. You don't. And Helsinki would be destroyed if it had a few 100 million people in it. We're looking for solutions that can work for 8 billion people. So then the point is through us and other research, you learn which parts of, because they're always experimenting with better and worse ways of delivering things. The Finns were starting out trying to get high grades, and so they led the rankings for all of this, but they were the first countries to say, this is not all about grades. And they were the first ones to say education should be about learning for well-being. The Nordic health authorities are also the first ones who've said, although that you'll see originally in the Nordic countries, they were slow coming into subjective well-being as an evaluator. They used more conventional outcomes. But once they've realized that in fact it is a central measure, they've started using subjective well-being much more in choosing among ways of delivering healthcare and measuring outcomes. So once you get on this positive ladder where people do care about each other, then they're less scared of change. They're more willing to co-develop things. The Nordic social and business structures are very much flatter than elsewhere. The gap between top salaries and bottom salaries, the extent to which people talk to each other up and down the vertical spectrum. And that leads to faster innovation and better innovation. It leads to less inequality. Less inequality leads to greater happiness. So you can get in this virtuous circle, but the point is, it may be hard starting, but you can do it anywhere.
We have a bunch more questions. So this one goes back to the comparison that was made to paying for subjectivity. If subjective measures are naturally occurring in healthcare, how is happiness currently being received and measured in the healthcare system?
I guess this is back at Thrive's home base. I think the answer is in most venues and most situations, it's not being measured. So that a lot of the research, for example, that was done in Canada, path-breaking research was done in a group in Ontario, where they took subjective well-being measures from the Canadian Community Health Survey, linked it up with the medical records of people, and then discovered that the people who were happier at the beginning, adjusting for all their medical conditions, in fact, used less healthcare resources to follow, and they had less morbidity and less mortality. Well, once you see that result, then you say, surely we should be monitoring the subjective well-being. But we're not yet. You see, the patients are typically given a mental health inventory, which is all about negatives, no positives. While we know the positives are at least as predictive of subsequent positivity, of course, but also other medical conditions. So that research showing life evaluations actually led to better health outcomes is the kind of thing we need more of in order to convince. You know, when I speak to GPs, the answer is you should be, at every time you interview a patient, you should be asking them about what social activities are they involved with. Ask them questions about their positive states of mind, not just their negative ones. Good health and high subjective well-being is not just the absence of negatives, it's the presence of positives. Well, it was in the original WHO statement of purpose, but it dropped out because medical care too long has been the repair of damage, not the creation of a good environment. So here we're lacking both practice and measurement. And I think they co-determine. So the more people start measuring it, then they'll find ways of deciding which aspects of practice doing it and which are not.
Yeah, I agree. I mean, we don't do enough in terms of also measuring positive aspects of people's health. I mean, at least at Thrive, what we're doing is, you know, in our surgical intakes, we do have the inventory of thriving. So at least we are trying to bring some change in terms of, you know, understanding where people are at with positive things in their life and not just focusing on the negative. We have another few questions, so I'll just quickly go through this one. So chapter 4 in the report focuses on how social media usage has impacted well-being. And so what are the main determinants of social media that are contributing to happiness and unhappiness respectively?
You want to start, Lara, and I'll follow?
Sure. Well, in the last little while, there have been 2 chapters kind of focused on this in the past couple of years. This year's report looks at social media as a way of actually collecting ongoing huge amounts of data about how people are feeling and kind of indexing that. So it's not so much as a predictor of well-being, but it is an assessment of well-being. And so this year's chapter kind of provides a case study looking at how people are self-reporting their emotions through the peaks and troughs of COVID rates and lockdowns, but also just a broader discussion of if and how this technology can be used to kind of advance the field of the science of happiness. In previous years, I think it was 2-3 years ago, there was a chapter on social media usage as a predictor of subjective well-being. And the story was a little bit, was not positive, kind of broadly suggesting that social media use is not good for subjective well-being. But there are really important intricacies. I think there's, the devil is in the details there about how one uses social media, whether it's a tool for engagement with other people, if it's a means for really kind of reconnecting with old friends and staying in touch, versus if it's a way to just put a false image of oneself out to the world that may not purely capture reality and really just facilitate some kinds of pretty detrimental comparison. I'll stop there, John, and you.
Well, it's been quite striking that during COVID, one way we put it when we launched the report 2 years ago is that social media have at last become social media and not anti-social media, because they were being used in negative ways and people were concentrating on that. But in fact, imagine how work and family life and pleasure would have survived over the last 2 years had there been no internet and no Zooms and no ways for us to remake the way we connect with each other. It has been essentially a lifesaver. And so, like all of these tools of technology, it depends entirely on how they're used. And our job as sort of scientists is to watch how they're used. But sometimes we get evidence of uses that are positive, so we want to tell people about them, and as well as the ones that were negative, as in that chapter before. So it isn't just controlling the bad uses of social media, it's in fact encouraging and studying the good uses of social media. Because when you think about it, it's one of the reasons why, one of the hypotheses we had about why among older people, subjective well-being was well maintained during the COVID years, was that for many, in fact, because migration of family members and so on had meant a lot of families spread around the world. And those families have not been able to see one another for 2 years. But through meetings like this, they have in fact been having connections and maintaining connections and building connections with each other to an extent that exceeded the amount of FaceTime they'd actually had with their relatives and friends over the pre-COVID years. Astonishing, but in many cases true.
I'm just going to paraphrase this question from a participant. So they're suggesting that, the media plays into focusing on the negative aspects of life and fear. And sometimes, we tend to fail in terms of providing some form of positive outlook in terms of how society can be improved. And so what advice do you have for using the World Happiness Report to make positive societal changes?
Well, I've got a specific item, and then Lara can be more general this time if she wants. It's a fact we have discovered that wallets are returned to people who lose them twice as much or 4 times as much, depending on the sample and the country, as people think they will be. So just for us to tell people that and to have them believe it would raise their happiness. It wouldn't just raise their happiness, it would raise the way they looked at people in the street, the way they would be prepared to treat a stranger as somebody, as a friend they hadn't yet met. Because after all, if it's really true that all those strangers out there will watch your back, they'll save you from a car crash, but they will return your wallet, makes you feel good about living there. So we discovered that people who think high likelihood that their wallet would be returned are much happier. And the boost they get from their happiness is much greater than the loss of happiness through being afraid of violent crime or mental health or any of these traditional things that we monitor. Well, if in fact the world is a much friendlier place than people think it is, your happiness is based on how supportive the world actually is. Your happiness is based on how you think it is. And if it's actually more supportive than you think it is, just telling that story through the World Happiness Reports and media reports and so on, in itself will make the world a happier place, because once you believe it's true that people are your friends, you're going to be happier just for that reason alone. But it goes deeper than that, because once you really see yourself as being among friends, you're much more likely yourself to reach out and get to know them better, to help them more, and just to feel nice about being around them. Given that gap, which is an unfortunate gap between a pessimistic impression and a friendly reality, simply knowing more about it can close the gap, and that's an absolutely costless way of improving both health and well-being.
Lara, anything you want to add?
No, I think that's a lovely example. I think my only addition is to broaden that outward, and just beyond just simply knowing how the kindness of the neighbors in one's environment. I think another really wonderful thing about the World Happiness Report is that it really sheds a light on a number of, first of all, assessing people's well-being as a meaningful outcome, and bringing that to the forefront of something we should care about. As John said, what you measure is what you treasure, and just kind of putting this assessment as a forefront and a concern, I think, is worthwhile. But also the expanding conversation and discussion about what it is that makes people happy beyond what is the typical objective realities that are, for many people, not necessarily at their fingertips. I mean, I think one thing that John has been talking about for years and years is the importance of the social context that comes through other people and trust. And I think those are top predictors for people's well-being year after year, and a recognition of that, I think, is an important place for inroads and for conversation, but also for changing happiness levels.
Right. We have another question that I think is nicely ties into what you mentioned. The term the care economy has been more heard in news and social media, and so are we seeing a shift of focus from this strict economic measures to something that is more care based?
So we hope. I mean, that's one way of taking these results on benevolence and saying that's an unscripted, unprompted description of caring, right? And then people can alter the behavior of the institutions they control and work in and live in, and nudge them in the same direction. That'd be wonderful. But the question is, after we've looked after the earthquake, as it were, we revert to something less caring. And we hope that once people have seen the advantages of caring and the opportunities for it, and let me link back to Thrive's own model here. You're wanting to you want to connect people with their own healthcare journeys, but you really also want to connect them with the journeys of others. And so then you can open doors to them to care for others, and people with different conditions connecting with one another, advising with one another, creating social opportunities for one another. The GP who cares is the GP who's going to tell you what's sometimes called social prescribing. They're going to tell you opportunities for connecting with others in positive ways. Well, Thrive has a platform that in fact is usable in these ways. So what you need is a sort of a fast reaction on part of the system, of which Thrive is part, to exploit these possibilities, to create more caring and to implement it, because it matters how trustworthy it is. It matters, all these fear mongering things that lead people to draw back. You have to, when you're trying to cure that, you have to have the technology that allows them to connect, but in in trustworthy ways.
So we have one last question. I'm just going to slightly reframe it. So it seems like we sometimes have this nostalgic view of the past was better, when there were happier times. And so is there a tendency to believe that we're in a worse time in terms of how we feel towards being happy? And are these assumptions true? Or where do you think we're headed with happiness?
John, I wonder if you want to speak to chapter 2. I feel like.
Well, yes, I mean, it's sort of what we've got data for now 15 years, and they've been flat in terms of these life evaluations. A number of emotions like stress, for example, and worry have been at a global level, have been rising over the last 15 years. Anger turns out to be much less prevalent than the other negative emotions or the positive ones, and not had a rising trend, interestingly enough, because if you just read the headlines, you'd say that was not the case. The very long term, how is life now compared to life a century or two ago? The evidence is quite clear that the opportunities available for people are much greater now. The actual resources are much available now, much greater. The actual years of healthy life expectancy you get, and this is true everywhere. If you look in Africa, the number of years that have been added to life over the last 25 is quite remarkable. So that in progress of things that really matter to life, there's been enormous progress over the last couple of centuries. There's been a lot of collateral damage, and there has been a inadequate attention to the quality of the social fabric within which we all operate, and just as there has been for the physical environment in which we all live. But the point is, if you can harness the ability to work together, those problems can be dealt with just as the more primary ones, or not necessarily more primary, but the others will.
All right. Lara, anything to add, or are we passing it to David?
I'll pass it back to David.
Sure, there we go with my bold Chawini in the background there. Felix wants to be a part of this. But I mean, maybe one last question before we wrap up, and it fits with the benevolence and thinking about different pathways that are appropriate for making use of this benevolence for different parts of the population. So children and seniors in particular. Any thoughts on that, and also how they can help one another as well? I know there's some interesting thinking around that.
Yeah. I wish we had more than 6 minutes, but yes, short answer is, I mean, I think I think happiness is really other people, and sometimes surprisingly so. I mean, we often default to the people we know and love already, but I think there's so much value in connecting people that we don't know with one another, and especially sometimes at different ends of some spectrums, there's just so much to be learned and so much to be gained. And so, as you may or may not know, John and I have been working on a project that tries to facilitate some of these connections and try to understand all the opportunities that this might afford. And so in particular, we've been working with this cross-generational program that's really aiming to connect seniors with high school students, not seeing either as the benefactor or the benefactor who's like giving of themselves. They're both contributing equally to these very, very honest, sincere, and authentic relationships, and gaining so much for it. And so I think, we often think about these two separate pools as groups of people who are in need of our guidance and our shepherding and maybe interventions to improve happiness. But I think we're just starting to fully recognize all the opportunities that might come from just bringing both parties together with a very clear and sincere kind of authentic interest in just getting to know one another. And from that, it quite naturally stems into how can they support and help one another. And it's been remarkable to see how much both parties gain from just being around one another, what they learn from one another, and anecdotally, kids and seniors reporting that these are some of the best moments of their days, their weeks, their months. John, what would you like to add to that?
Well, we need to show those data to the people who are stopping the kinds of linkages, let people with mental health problems cure other people with mental health problems through sharing and caring. To get this elementary school class into the elder care facility took a lot of doing, a lot of nerve, a lot of breaking old rules and making new ways of doing it. You'll find this throughout the healthcare system, I know, that because you're really changing the model, you're making it more sharing and mutual regard and mutual support, and not top-down professionals to children on the one side and elders on the other. To let them enliven each other. It's been quite striking. Shows that people are too risk averse. The people who are running institutions are simply too risk averse. They don't want anything bad to happen on their watch. And yes, something can happen that's bad, but all the good things obviously outweigh the possibility of something bad for most of these mixings.
And COVID was a very strong test of that, right? I mean, everybody's sensitivities went through the roof for protecting, elders in this care facility, and still, I mean, there was a pause in this program, but then they reconnected, and the emotions were so high, and the connection so true.
Well, and even in Zoom, the classic interview where we all met this wonderful woman and saw the interaction between her and the children. Without COVID and without Zoom, we wouldn't have seen that.
That's great. Well, thank you so much. We've got a couple minutes left, so I think it's time to wrap up. And I want to thank both of you, and also we have guests from across Canada, the US, and Europe on this webinar. So thanks for staying up, our European friends. So, I mean, I think messages to take away from this is, there's definitely hope, and there's a lot of good stuff to work with, and more than people recognize. I think I even noted that John, you were mentioning the solution to both climate change and world peace was there, so we can check that off the list for just having people encouraging common action around shared objectives. So I think, if we just keep working on that, and really there is room here for a rewiring of how the healthcare system works, which isn't going to be easy, but I think a lot of the work that you've been doing, and others on this call, and I know there are some people from Purdue University here who've been doing some really interesting work as well, both on the ground and at the policy level. There's just a lot to be done. So in the interest of making connections with everyone who's on this group, please do feel free to follow up with us or with Lara and John directly. If you don't have their contacts, we can help with that, because I think together, with people who are on this call and interested in these conversations, we've got a ton of potential and frankly, a lot of work to do, but there's a lot of positive signs that we can make it happen. So thank you so much for all your work, both of you, on these annual reports, and for sharing some of your pearls of wisdom with us today.